Hi,
Hey, I'm Jeff.
I'm Patrick.
Good to meet you.
Let's have a seat and talk real quick. So today we just kind of want to get to know you a little bit. So Dr. Curtis, what inspired you to become a doctor?
I was close with both of my grandfathers, loved, respected both of them. One of them was a physician, and I think his example was probably the most important thing that made me want to be a physician too.
And was there a moment in your life that, in your childhood or in your collegiate career that you kind of just knew, like medicine was in your future?
For me, it came down to two things. I either wanted to be a professional musician or a physician. And the only thing that kept me from being a professional musician was a lack of talent. So I knew it was medicine for me. But I really, ever since high school, I wanted to be a physician.
Tell us a little bit about the personal values that you have that you bring to your medical practice.
From early on, I've really wanted to serve my patients. I remember in college, before even going to medical school, having long discussions with a dear friend about how we both wanted to go into primary care, both wanted to do family medicine to make a difference with our patients. Which is not to say that other specialists don't make a difference. Of course they do. They make an enormous difference. But for me, the thing that really attracted me was the one-on-one long-term relationships with patients and the ability to make a difference on a long-term basis in their lives, to be there as kind of the traditional physician. That was what I saw as what would be satisfying to me professionally and personally, and maybe contribute a bit to the world. I'd like to think I've made a difference in some of my patients' lives for the better.
So speaking of concierge medicine, how is it different than a traditional primary care setting?
Unhurried appointments. We get a lot of time to really understand, for me to learn to understand the patients and what's important to them. The patients have 24/7 access to me. They can pick up the phone and call me and I'll answer it. We also have a patient navigator who is available to them 24/7. We're available to the patients. It's all about meeting their needs.
Can you describe a typical visit in concierge medicine and compare that to a primary care model and kind of highlight some of the differences?
So in a primary care model, I show up at the clinic first thing in the morning and I've got, say, 14 patients in the morning and I just kind of work through all of them. With a typical concierge patient, maybe I would have gotten a text from them the night before saying that they've got a concern. I need to make sure that it's not something urgent enough that they need to go to the emergency department then, but most of the time it's not. So then I can say, hey, I know my schedule tomorrow. I know that I've got an opening at 9 o'clock. Let me just confirm with our scheduler and maybe our nurse navigator, and I'll see you at 9 o'clock tomorrow morning. Ideally, this is a patient that I already know. I've got an established relationship with them already, but even if they're a newer patient, I will have had time to review their record, to understand a bit about their health conditions, to know where the issue that we texted about fits in the greater context of that person. And then when I see them the next morning, I've got time to find out what's important to them, to ask really what matters to you and what's going on now and how can we work together to optimize your health now and in the long term. Again, in a very unhurried way.
Thank you so much for taking some time to sit down with us today.
It's my pleasure. Thank you.